Hello, and thank you for joining us today. My name is Randall Evans. I'm the Deputy Commissioner of our Customer Operations Division here at TDI, and I would like to introduce you to our next speaker, Cindy Wright. Cindy is the Director of our Consumer Protection Division, which includes our Independent Dispute Resolution or IDR team. Cindy?
Hi, my name is Cindy Wright, and I'm the Director of Consumer Protection here at the Texas Department of Insurance. Today, we're going to talk a little bit about Senate Bill 1264 and the independent dispute resolution process. Because balance billing is a consumer protection issue and related to complaints, the area of the agency responsible for administering it is in our Customer Operations Division. Randall Evans is our Deputy Commissioner of Customer Operations, and what I wanted to do here is just kind of share with you a little bit about how our division is structured and some of the things that we do. So in Customer Operations, we have three different sections: Agent and Adjuster Licensing, Contact Center and Services. This is where our consumer helpline and also our agent and adjuster helpline are operated. And also data services, which is where we get a lot of the material that I'm actually going to be presenting to you today. Then finally, consumer protection includes a couple of different programs: complaint resolution, agency disaster response, and our TWIA ombudsman, and the independent dispute resolution program. Since the bill was enacted in 2020, we've seen a really dramatic reduction in health complaints in a couple of key areas. One, with providers, healthcare providers, concerned about low reimbursements for their out-of-network services, and two, from consumers concerned about surprise medical bills. Our focus in the IDR program is, first of all, to ensure that health plans comply with Senate Bill 1264. We do this by encouraging their participation and response, and also ensuring that they pay for the services that they receive from mediators and arbitrators. We educate health plans, healthcare providers, mediators, and arbitrators on the program. This means we talk to them about the statute and the rules. We provide presentations to them, some coaching, and just ongoing support. We administer the Independent Dispute Resolution Portal, and this is something that we're really proud of here at TDI. It's actually an application that we built together with our ITS partners here at the agency. It's viewable by all of the participants in the program. So the healthcare provider that submits a request through that portal is able to see it from start to finish. The health plan is able to respond to that request and enter the details that they're responsible for. And also, any mediator or arbitrator that's involved in a specific request is able to view exactly that same information. We provide customer service to all the participants. So as you're going to soon see, there's a tremendous volume that flows through this program, a volume of requests, a lot of participants, a lot of people that are interested and involved in what's going on. And so we're responsible for responding to all of their requests for information and just requests for assistance. We will sometimes refer compliance concerns. This is true internally, so TDI regulates health plans. If we have a compliance issue with the health plan, we'll work with our partners in the enforcement division to try to bring that health plan into compliance. But we also work with other agencies that are responsible for enforcing the law. That would include the Health and Human Services Commission and also the Texas Medical Board and a few others. We maintain the list of commissioners' approved mediators and arbitrators. That's available for viewing on our website and also through the portal once someone logs into the system. And we also collect and analyze data. We collect and analyze an awful lot of data. So there are an awful lot of ways to resolve out-of-network payment disputes that really don't involve the IDR process at all. We're just going to mention a couple here. Providers can always submit a formal appeal through the health plan that they filed a claim with to try to resolve a dispute that way. Health plans and out-of-network providers could engage in a contracting process if they chose, or they could negotiate informally through other channels. IDR is not an obligation to participate in, but once the process is engaged, it has to be followed through. I want to just talk for a few minutes about some background associated with the Senate Bill 1264, or nowadays we kind of refer to it as IDR since it's a fully fledged program that arose from the bill. Before the bill was passed, so this would be pre-2020, there was a mediation process in place. This process actually required that the consumer receive a balance bill. So this would be anything above their ordinary cost shares, so deductible, coinsurance, copayments. If they receive that balance bill, then they could reach out to TDI, and as long as the health plan was covered under the existing law, we would help them through a mediation process. So all of this, remember, hinged upon the consumer receiving that balance bill and reaching out for help. When Senate Bill 1264 was passed in the 2019 legislative session, it changed the dynamic entirely. It still applies to fully insured health plans, ERS, and TRS. It also applies, just from a services standpoint, it applies to medical bills for services or supplies that were received on or after January of 2020 for either emergency care, out-of-network services received at an in-network facility. So these will be situations where the consumer didn't really have a choice in who was providing their treatment. Think of radiology or assistant surgeons, for example. And also, it applies to lab or imaging services that are in connection with in-network care. The law protects consumers, so it does prohibit providers from balance billing, again, for those amounts that are over what ordinary cost shares would be, deductibles, coinsurance, copays. It requires that health plans give notice of balance billing prohibitions. So this includes on an explanation of benefits that the consumer would receive, and also a remittance advice that the provider might receive. It creates two processes to resolve disputes: mediation and arbitration. So mediation existed previously, remember. Now, since Senate Bill 1264, the mediation process applies to facility claims. So think hospitals, freestanding emergency rooms, for example. The timelines for that are still the same, and we'll talk about that here in the next few minutes. But it also created an arbitration process. Arbitration is available for professional services. Let's talk about the arbitration timeline really quick. So we know that there are two different processes: arbitration for professional services, mediation for facility charges. When an arbitration request is entered or submitted by a healthcare provider, that request can be made 20 days between, I guess is a better way to say it, between 20 and 90 days after the date the provider receives the first claim payment. So the provider needs to wait 20 days to submit the request and has until 90 days to enter it. When we talk about first claim payment, we're really talking about, let's think about the health plan's allowed amount. So regardless of who actually makes that payment, let's say it's in January of a plan year. Early in the year, the patient hasn't satisfied their deductible yet. Most or all of that claim payment could be coming from the consumer, but the date that is first received is what triggers this timeline. Once the request is entered, the provider needs to notify the health plan. For arbitrations, providers can aggregate up to $5,000 in dispute without needing agreement from the other side. So let's say there are 3 claims, each with a disputed amount of, $1,500. The provider could enter all 3 of those claims on the same request and stay underneath the $5,000 threshold. When the request is successfully submitted, that triggers the timeline to begin. The first 30 days are an informal settlement period. The parties might be able to settle, but on that very first day, once the request is entered, a list of 5 potential arbitrators is going to populate in the portal for the health plan and the provider to view. Each side gets to strike 2, and these are blind to the other side. So keep that in mind. Once the strikes are made, that can happen at the very beginning, whether or not the parties are actually able to settle informally. The timeline for this informal settlement period can be extended by mutual agreement for an indefinite period of time. During this first 30 days, we mentioned before that the provider has to notify the health plan that they've entered the request. The health plan has to acknowledge, and then the negotiations need to start. On day 31, the TDI portal assigns an arbitrator if one hasn't been agreed to by the parties in advance. So think back to the strikes that each side was able to make. Any remaining arbitrators on that list that haven't been struck are up for just a random assignment on day 31. So day 31, that random assignment happens from those on the list that remain. And the timeline obligates the parties both to pay the arbitrator upon assignment. The law also obligates them to participate. So at this point, the arbitrator is probably going to ask them for some information, position statements, for example, additional information, and they're also going to present an invoice for services. On day 51, the arbitration deadline comes, and this is the point by which the arbitrator must submit their report through our portal. Some things are similar with the mediation timeline as are with the arbitration timeline, but there are some key differences. Again, the request can be made after 20 days after the claim payment is made, but there's no upper time limit for mediations. So the request can be made at any point after that 20-day lockout. Again, the first 30 days starts that informal settlement, or is that informal settlement period. The parties can settle, they can select a mediator on their own by mutual agreement, or they can take advantage of the strikes that are offered to them on the list of 5 that populates on that first day. On day 31, the portal automatically and randomly assigns a mediator from the list that's not been struck, and then that starts the process of the actual formal mediation conference. By day 180, the mediation has to have taken place, and then 45 days after that, the mediation report is due from the mediator. Just to kind of lay the timelines side by side and give you an idea of how they're similar, So day 1 through 30, we have the informal settlement period. After day 30, or essentially day 31, the case is assigned if it's not settled. For arbitration, day 31 through 51 is where the arbitration happens and the arbitrator submits their report. For mediations, day 31 through 180, the mediator schedules the mediation conference, assists the parties in trying to arrive at a settlement, and then after that takes place, the mediator report is due within 45 days. I want to take a few minutes here to kind of walk you through what the IDR portal actually looks like for all of the participants. The first step along the way, we've already talked about the timeline, is that healthcare provider can go to the TDI website and access our portal. They can, establish a username and password and immediately begin to enter a request. Providers or their representatives are able to access it as long as the representative has permission from the provider. Requests, again, can be entered 20 days after that first claim payment. And providers are able to monitor the submitted requests from their portal dashboard. A couple of things to point out. For the arbitrations, there's a date validation that prevents a request that's over 90 days after claim payment from being entered. The account that's created by the provider is directly tied to the email login. So provider might choose in their office to have multiple people using that access to enter requests into the portal. They'd all be viewable on the portal dashboard, which you see here. Once the provider starts entering this request, there are really just some basic claim details that are required. Providers really should verify as much as possible that the patient's plan is eligible. And if you can see on the slide here, a pop-up window walks the provider through that very thing. If you see the questions listed, if their health plan card has a TDI or DOI on it, of course, that's an indicator that it's a fully insured health plan and subject to the law. If the health plan card has Health Select of Texas, that signifies that it is ERS, or Employee Retirement System of Texas, also covered under the law. If the health plan card has TRS Active Care on it, that signifies that it's a part of the Teachers Retirement System of Texas, another plan type covered by the law. The portal questions, and this is just one set of them, the portal questions really do guide the user through the entire submission. After the request is submitted, the health plan is going to be able to view it and they'll be able to make some updates. When we talk about basic claim details, we really, really do mean that. There aren't any CPT codes or claim detail captured through the submission process. The provider enters the billed amount, the amount that was paid, the patient share, and the system calculates the disputed amount. The only additional thing that the provider needs to do is identify the family of company. So we understand that a lot of the time the provider is not going to know which specific type of health plan is offered, just that the family name might be on the front of the card. Now, moving on to the updates that the health plan makes, this window is kind of an indicator of a few pieces of information that the health plan is able to flesh out. There are some things that we know the health provider is just not going to know. So the health plan lets us know the NAIC number associated with that particular insurer, the specific type of health plan, whether it's an HMO, PPO, etc. And then there's a key question that we ask right at the beginning. Did the health plan issue an EOB that says if you disagree with the payment amount, you can request mediation or arbitration? It's a really important question. Now, if you remember, there are balance billing prohibitions, and one of the responsibilities of the health plan is to notify both the consumer and the provider of the protections of the law. The health plan's are also responsible for entering the results of the informal settlement period. This is a really important report, but there's not really a whole lot to it. We're kind of proud of the ease of use that we were able to, capture in the development of the portal. So just basic information is going to be required of the health plan. When did they receive the dispute from the provider? What was the date of that informal teleconference? Whether or not it was settled, and if it was settled, what was the settlement amount? The other information at the bottom is captured once the payment is made. So this field remains unlocked for the health plan to kind of finish it out as they are made aware of what the actual payment details are. So we've looked at the submitter or the provider's kind of view of what the portal looks like when they're submitting a request. We've also looked at what are some of the health plan updates and what's the informal teleconference report look like. The next set of portal views are actually owned by the facilitator. We kind of use that as a generic term to cover both arbitrators and mediators. So if we look first at the situation of an arbitration, if the health plan and provider didn't settle and indicated that in the informal settlement report, on that 31st day, this request would have been assigned to an arbitrator. Between day 31 and 51, the arbitrator is going to do a couple key things. This report captures what those key things are. So arbitrators record the reasonable amount based on that they've decided based upon the 10 factors that are laid out in statute. And this would be in the Insurance Code, Chapter 1467, and I'm just paraphrasing here. So there are 10 factors that the arbitrator has to review. First, the disparity between the fee billed and those paid for the same services to the provider and those paid by the health plan for similar services to similar providers. Second, the level of training, education, and experience of the provider. Third, the provider's usual billed charge for a comparable service. 4, the circumstances of the individual case. 5, specific enrollee characteristics. 6, the 80th percentile of all bill charges for similar service. 7, the 50th percentile of rates paid to participating providers for similar. 8, the contracting history between the parties. 9, historical data for those percentiles that were already mentioned. And 10, any offers that are made during the informal settlement period. So the arbitrator needs to answer 2 key questions. 1, what is the reasonable amount? That's a determination that the arbitrator makes based on those 10 factors. And then second, who's closer? The closer side wins, and the closer side's final offer is the winning amount. So in this arbitrator report, we can see the arbitrator's recording the date of the arbitration, the date of the decision, when the report was submitted, the date the parties were notified of the award, the provider's final offer, the health plan's final offer, the reasonable amount, and who's closest. There are a couple of other questions at the bottom of this report that really speak more to obligations on the health plan and provider to participate in good faith. Were you paid by the health plan and were you paid by the provider is a way for TDI to capture this information. The fields that you see at the bottom of the screen are completed by the health plan once the arbitrator submits their decision. On the right side of the screen, you see a mediator's report. And it does look different from the arbitrators. And this is for a couple of reasons. First of all, there aren't any final offers that are captured in this particular report. The first question is, was the mediation settled, yes or no? Mediations aren't binding. They don't always settle. So we capture the information of whether or not they did, the date of the mediation, the date the mediation concluded, and what the settlement amount actually was if there was a settlement. Again, those same questions are asked. Did the parties pay the mediator? The program has just seen a tremendous amount of volume coming through since the law was enacted in January of 2020. So far, almost 193,000 arbitration requests have been submitted. More than 107,000 of those settled within that first 30 days. More than 53,000 were decided by an arbitrator. And we wanted to just draw your attention to who the top submitter types are by volume. So 71% of arbitrations so far have been submitted by emergency room physician disputes. So there's a couple things I want to point out, because if you do some quick math, you'll see that that doesn't all add up to the top line that you see there. Some requests are actually ineligible. So we try, as like we were talking before, to walk the provider through submitting something that's going to be an eligible request. We have questions throughout that submission process to really help the provider determine, if it's not an eligible request, what some other options might be for them to resolve their dispute. So some are not eligible, some are withdrawn. So a provider might submit a request, and if they were successful in negotiating outside the system, they may decide to withdraw the request if they've already been satisfied. Another point to mention is a lot of that number, that 192,000 number, includes requests that are new within that first 30 days, and they haven't had an opportunity to settle yet. On the mediation side, we can see that there are more than 54,000 requests submitted, so quite significantly fewer than arbitrations. More than 35,000 have settled within the first 30 days. 1,200 or so have finished mediation. And out of that 1,216, 382 of them have settled. And again, just drawing your attention to the top volume provider type, this on the mediation side belongs to freestanding emergency rooms. Around 78% of our requests so far have been submitted by freestanding ERs. Now, these are really big numbers on this slide. We're just looking at IDR program statistics. Without the consumer protections that were provided in the Texas law, the total disputed amount shown that you can see here, that grand total, could have been passed on to consumers in the form of a balance bill if the protection wasn't in place. Providers and health plans have resolved almost $1 billion in disputed payments through this program. It's quite an impressive number, and you can contrast that with the roughly $72 million that consumers saved with the previous mediation system that was, if you remember, required a consumer to initiate the request and also required that they had received a balance bill in order to engage in that. We can see the program growth since 2020. So January of 2020, we think we saw our very first request on Valentine's Day or somewhere around the middle of February. And then from that point, the requests have done nothing but steadily increase. until, you see our grand total here, not even halfway through 2022. These numbers, by the way, include all settled requests, things that have been settled at least up to now, remembering that the submitters and the health plans on mutual agreement can extend deadlines if they need to for whatever reason and for any length of time. But for requests that were settled either informally or through mediation or arbitration, those numbers are captured here. We wanted to show you a little bit about mediator and arbitrator fees. So I mentioned this previously, but if something isn't settled during that informal period, a mediator in the case of facilities or an arbitrator in the case of professional services will be assigned on day 31. Fees are due upon assignment. TDI doesn't set the rates by any means at all that mediators and arbitrators charge. We don't have any involvement in processing payments. That belongs to the parties only, among the parties and the mediator or arbitrator that's assigned. We do ask a very key question, which is, were you paid? If that answer is ever no, it's a potential indicator of bad faith participation. But you can see the numbers here. We have on our roster right now 180 arbitrators, 197 mediators, and you can see their fee ranges on the low side for mediation of $80 all the way up to $3,000, and for arbitration, $400 on the low side and $6,000 on the high side. We thought you'd really be interested in seeing outcomes of the program. So I first wanted to talk about arbitrations, and you've got two different views here. The top view shows you requests that settled informally. It's good to know that almost 60% of the closed arbitration cases were actually settled informally. So this means that the health plan and the healthcare provider were able to resolve the dispute during that informal period that didn't cost them anything at all. And these are averages that you see. The average initial billed amount was $4,059 for requests that were settled informally. The average original payment's $251, and parties ended up settling at an average of $909. Now, important to point out that this is for single requests only. Remember that the system enables or allows providers to submit multiple claims on one request, provided that the amount in dispute doesn't exceed $5,000. So to kind of keep the comparison the same, we're only looking at single claim disputes here. If you look at the bottom graphic, these are requests that were settled in arbitration. So an arbitrator was assigned, an arbitrator was paid. Each party is responsible for paying half of that fee. Again, the arbitrators decide the reasonable amount, and then the party whose final offer is closer is awarded the decision. So in this case, our averages are a little over $2,900 for the billed amount, $283 for the original payment, and $969 on average as the awarded amount. Want to take a similar view at mediation request outcomes. So remembering mediations are not binding and they are involving facility charges rather than professional services. So the top graphic here shows you mediation requests settled in informal teleconference. Approximately 74% of the time, or 74% of the closed mediation requests that are in our system now, did settle informally. That's pretty impressive. Out of an average little over $12,000 billed amount and a little less than $1,200 in original payment, the settlement amount averaged $2,400. Now, settlements with a mediator are a little bit different. Parties aren't obligated to settle. Some mediation requests close without a settlement figure. So our data set is a little bit smaller here. Mediation requests, again, just reminding you, can aggregate an unlimited number of claims if both parties agree. But here, again, we're only comparing single claim requests. Approximately 31% of the requests, at least so far, that were assigned to a mediator settled at that mediation conference. Wanted to talk for a few minutes just about some of the trends that we've noticed in the portal, or maybe a better way to describe this would be advice that we have for health plans or providers that want to participate in IDR. Just reminding that it's not an obligation. Parties are absolutely able to negotiate and settle outside of this process. But once they do decide to use it, then there are responsibilities on both sides. Some of the things that we've observed just from the experience that we've had so far. So this is now over 250,000 requests that have come through the portal. Some of them entered actually involve ineligible claims. So we had a few bullets that we wanted to go over about that. Self-funded plans are not part of this process. So the Texas law was enacted in 2020. There's now a new federal law called the No Surprises Act. Requests that are not eligible because they might involve a self-funded health plan could potentially qualify or be eligible for that federal process. This process, Texas IDR, is only for approved healthcare services. So denied claims aren't eligible. This process isn't intended to resolve medical determinations or decide whether or not something is a payable claim. It's only for claims that have actually been paid, even if that payment was zero. Claims that are entered more than 90 days after a claim payment aren't eligible for arbitration. On the mediation side, so for facility dispute, the only requirement there is that there's a 20-day waiting period and there is no upper limit on the number of days. Our system doesn't allow for duplicate entries. This is a great feature for both the health plans and the providers, because sometimes, that kind of thing just happens. If a claim shows up on a spreadsheet more than once, sometimes folks will want to enter that again. It saves everyone time that our system kind of pops a message that says, hey, we can't enter this one a second time. We've really enjoyed getting feedback from portal users to make enhancements as we've gone along. So since 2020, there have been a number of enhancements to the portal. We've improved the guided submission process to help providers know when a claim isn't eligible. We've also improved and increased the amount of plan detail that health plans can add to round out that claim information. And we've also added a feature that I described before, that mediators and arbitrators can alert TDI to payment delays or a potential lack of participation. I guess the last and most recent update that I wanted to share with you before we end here is that in light of the No Surprises Act that went into effect January of this year, we also added a portal enhancement that enables health plans to indicate when a group number is ineligible for the state level process and potentially eligible for the federal No Surprises Act.
Thanks for joining us today for our webinar on the Senate Bill 1264 and the independent dispute resolution process. I'm Ben Gonzalez with TDI's Public Affairs Division. You can always email questions today or later on to idr@tdi.texas.gov. Again, it's idr@tdi.texas.gov. And joining us to answer your questions is, of course, our presenter, Cindy Wright. Cindy is the director of TDI's Consumer Protection and Services Office. She oversees the agency's independent dispute resolution and complaint processes. Hello, Cindy.
Hi, Ben.
And joining Cindy to field some of the questions today is Marcus Wilcox. Marcus is the manager of the Independent Dispute Resolution Group here at TDI. Hello, Marcus.
Hey, Ben.
All right, before we get going, just a couple of last notes. Any questions that deal with a specific company, we're not going to answer those online. You can send those to us later offline, and we'll try to get you an answer via email. Again, idr@tdi.texas.gov. And we are focusing today on the Texas process for IDR. So, all right, I'll pull up the questions and start reading them out. Cindy, the first one is the arbitration and or IDR from TDI available to air ambulance providers? That's a big one. One of the people we're in a payment dispute with right now said they weren't eligible for this process, but have posed the CMS IDR process instead. Which one should we use for providers and plans?
Yeah, well, the Texas law doesn't actually cover air ambulance or ground ambulance claims, unfortunately.
Okay, straightforward answer there. How do mediators determine what is considered usual and customary? What's allowed for the different amounts? Is the information provided by TDI through a vendor like Fair Health for arbitrations?
Gotcha. Two different questions. So let me do it. The first one is, okay, refresh my memory again. So the first question is, are they using Fair Health?
Right, are we using
Okay.
Fair Health?
Yeah, so mediations aren't binding. Mediators aren't determining necessarily what a usual and customary amount is. They're helping to facilitate a conversation between the two parties and hopefully, helping them arrive at a settlement. So the determination of usual and customary really is part of that conversation, not tied necessarily to a database like Fair Health. However, on the arbitration side, so these would be professional services, individual physicians, et cetera, that are filing arbitration requests. The arbitrators that are helping with these in these situations are accessing Fair Health as the database that to help them determine, part of those 10 factors that we talked about a little bit earlier in the presentation.
So it's certainly a resource out there that people are using. Is there a maximum dollar amount for the mediation process?
Yeah, Marcus, do you want to take that one?
Sure. So for the mediation, there is no maximum dollar amount. For arbitration there is, but not for mediation.
Okay, thank you. Next question. You mentioned the claim aggregation of 5,000, and I've seen info from TDI that says if aggregated, it is 5,000, but an individual claim is unlimited. Is that still correct?
Yeah, that's exactly right. And it's a great follow-up to the question right before it. So for arbitrations, providers are able to aggregate up to $5,000 in dispute, but any single dispute could be any amount. On the mediation side, like Marcus was just describing, they can aggregate on mutual agreement up to any amount.
Okay, sounds good. Does Senate Bill 1264, oh, we have already answered this, ambulances, does not apply to ambulance providers at this time, correct?
Right.
Okay. Moving on to our next one. It's really difficult to determine how to interpret individual payers' EOBs. They're all formatted so differently. Some payers put in the non-allowed amounts, others don't. I believe any provider is trying to do the right thing. The problem is these EOBs are so unclear. How do we determine what should go to the patient?
So I'll take that one. The best thing to do in a situation like that is to file a complaint. It's difficult for us to, we definitely want to answer hypotheticals, but, if we get a complaint, we can actually take a look, request the information, and we can determine it better that way. It's not that we don't want to answer these kind of questions. Like the person said, there are lots of different types of EOBs, so it's kind of hard for us to determine that without actually looking at it.
Okay, perfect. Thanks, Marcus. Here's another one. Can TDI RDR request that notifications be made to the mediators if there's a settlement out of the mediation process? Rarely do I ever receive information until I alert the parties that the deadline is coming up and they say it's already been done.
Gotcha. So it sounds like this is one of the mediators for the IDR program. We can certainly do that. And in fact, there are quite a few automated messages that go out all along the way. And Marcus can probably chime in here and add to it. But when the request is, at the very first day when the request is submitted, there's a message that goes out. There's a couple touch points. When it's assigned to a mediator or arbitrator, there's an automated message at that point, and then reminders from then going forward that, hey, there's things for you guys to do. And so that's definitely something that we can take a look at adding an automated message or just language to the messaging that already goes out. Also, the mediator or arbitrator can certainly contact all the parties and say, hey, here's my expectation. If you settle outside of this process, I'm responsible for submitting that report. Please provide me with the details.
Yeah, and if as a facilitator you don't feel comfortable, please contact us. We'll be happy to send out an email. We'll make sure we copy all parties and ask for an update on the situation.
Okay, thanks. Next question. If we find that there are typographical errors in the claim dollar amounts or in the radio buttons, how can the plan get those updated during the process?
It's funny. We actually look for errors. So we have a report that we run that looks for errors. There happen sometimes people will enter the date where the dollar amount is supposed to be, and we actually reach out and ask for the plan to update that information.
Right, and I don't. It might not have been clear in the slide deck, but that's one of the set of fields that are able to be edited. So the health plan, if someone's transposed a number, for example, the health plan actually has the ability to go in and edit those numbers directly.
Yeah, but if you see something before we see it, please let us know. Like I said, we'll reach out to the health plan. But we do run reports, and there's certainly outliers, right? When all of a sudden there's like, it was the 5th of May, and there's 5.5 million. So we do look for stuff like that. So, but if you see something before we do, let us know, and we'll ask for it to be fixed.
Okay, sounds good. If the patient's policy has out-of-network benefits and the out-of-network deductible has not yet been met, can that amount be billed to the patient, or is it considered a surprise bill there?
So if the patient is still in the, early in the year where they're still kind of subject to that deductible, that the ordinary cost shares that the patient is, the part of the policy, in other words, policy terms, that wouldn't be considered a balance bill. So the patient's still gonna, be obligated to their ordinary deductible, ordinary cost shares. And then over and above that amount would be what we would consider a balance bill.
Okay, here's one on the 10 key factors. Do you only need to know those 10 key factors if the case goes to mediation and arbitration? Is that when we'd use those?
Yes, I'm sorry, Cindy.
No, you go ahead.
Okay, yeah, the 10 factors are what should be used by the facilitators to make their determination. So they have access to Fair Health. That's where that information comes from, and that's what should be used to make the determination.
Absolutely. And one thing to clarify too, I think the question said mediation and arbitration, but the 10 factors are used for arbitration. Mediation, that's not part of the mediation process.
Okay, good clarification there. I know we said we're going to focus on the Texas process, but somebody asked, has there been a decrease in the number of arbitration claims assigned to arbitrators since the no surprises legislation went into effect? Are you watching that?
Yeah, we are actually. We're always watching data come through, and that's why we're really excited to share some of that, with folks in the presentation. And Marcus can chime in here too, but it's kind of interesting, just an observation around November timeframe. We started seeing fewer requests coming through our portal, mediations and arbitrations, but that trend reversed, I think, toward the end of March. April saw the highest volume we had seen up to that point. So around 18,000 requests came in the month of April. So we're watching these things come through, right? We're watching all of the data as it's presented, as that information is being entered into the portal, but we don't really necessarily know the cause. It was just kind of an observation. Wow, we're seeing a trend down. Now we're seeing it trend back up again. So.
All right, well, go ahead, Marcus.
Sorry, Ben. Yeah, I was gonna say, and when we noticed that data, I did reach out to some health plans and we compared our data and their data. There wasn't we couldn't determine what was causing the drop, but it was impacting, the percentages stayed the same. So overall, the total number of requests was down, but the United Healthcare still had the same percentage. Blue Cross Blue Shield. So we're not exactly sure what caused the drop, but like I said, from a percentage standpoint, it stayed the same.
Okay. I was just going to say, we've only got a few more minutes, so we're going to try to run through a couple more. Has there been any thought to setting a flat arbitration or mediation fee? Any numbers been suggested?
No, there's nothing in the statute really that does that. So at this point still, arbitrators and mediators set their own fee. They notify us. I don't know if we mentioned this in the presentation earlier, but part of that law obligates TDI to maintain that list publicly. So it's available on our website, as well as the, CVs and resumes of the mediators and arbitrators and their fees. So they're definitely posted. TDI doesn't have any involvement, in setting the fees. And I don't know that we would. That would probably be a legislative action, if so.
Okay. Sounds good. Here's one on the information that was provided in the presentation. What was the time frame when we were looking at those outcomes in the slides?
Yeah, well, those were, so when we're talking about averages, and I'm trying to think back through all of the slides, really almost all of that data was from the beginning of the program, January 1st of 2020 up to April 15th is when we kind of drew the line and said, okay, we need to go ahead and populate the slides with the data.
Okay, sounds good. Here's one. Can a failed mediation then move over to the arbitration in the portal?
You want to do that one, Marcus?
Anyone?
That's
either way.
I was gonna say I've not seen that before, Cindy. I don't know if you have. So I don't. No.
Yeah, I think just because the way the law is written, it's pretty distinct. Mediation is set aside for facilities. Arbitration is set aside for professional services. So even if, let's just say, there was kind of a date of service, there's a whole, set of services that a patient received, we might see a mediation request come from the facility, for example. We might see an arbitration request come from any of the professionals that provided service to that same patient, but they would never cross paths or change course. Once they're kind of in there, they're pretty set.
Yeah, as you were speaking, I can't even think of an example of like when that would apply. So yeah.
Yeah, and it's kind of interesting too, because we talked in the presentation about there's really not a lot of data that we're capturing that's specific to the provision of the services, right? It's very basic, a claim number, a way for the health plan and the provider to agree on, okay, this is the claim we're referencing. The patient name is just, a free form field, for example. So there's no service detail that's being captured. So yeah, just wanted to kind of point that out, that it's pretty minimal information that's going in there.
All right, we have a lot of questions that unfortunately I don't think we're going to get to because we're down to our last minute, but I'm going to make this the last one. If you feel like you're not, what is the recommendation when the insurance company is not making enough efforts, you think, to settle with the mediation? Is there anything we should do at that point?
So if the insurance company is not making, is this from the provider standpoint, they're feeling as though, or they're thinking that the insurance plan isn't
The details aren't there. It's just you feel like the company is not making, it must be from the provider stance, I guess, if they're not making efforts to settle.
Yeah, it sounds like it is. I mean, my recommendation would be to reach out to the folks in IDR. It's a small, Marcus is very, a fan of saying this. It's a small program, but everybody on that team is a real expert and they're always glad to help.
Okay, I'm afraid we're gonna have to wrap it up there. I'm sorry, we are out of time. If we didn't get to your question today, or you think of another question that you want addressed, please send them to the email that we mentioned earlier, idr@tdi.texas.gov, and we'll try to get answers to those if we can. All right, that's it for today. Thanks for joining us. Have a great rest of your day, and we'll see you in 2 weeks.